Hi, I'm student nurse Alyssa, and I'm going to be doing a newborn assessment today. Okay, so I've already performed hand hygiene, so I'm going to go ahead and get started. We're going to start with the vital signs for the baby, so I'm going to begin with respirations. The baby's respirations are normally about 110 to 160. The heart rate, that's the heart rate. The respirations are 30 to 60. So I'm just listening to make sure there aren't any adventitious sounds. It's normal for there to be a little wetness in the sound. And then I would assess the back. Okay. I'd also be assessing the heart rate, which, like I said before, was 110 to 160, so just the 5 areas. And the apical. Okay, since I already have my stethoscope, I'm just going to go ahead and do the bowel sounds. Make sure everything's functioning normally. Okay. Everything's normal there. Next, we're going to do the weight. I would place the baby on a scale and measure it in pounds, ounces, and kilograms. Next, I would assess the length of the baby. So I would measure where the head is and make a pin mark, and then stretch out the heel, mark where the heel is, and then I would just measure that area, those 2 pin marks. Since I already have my measuring tape, I'm going to go ahead and measure the head circumference right below the hairline on the forehead area. Okay. And then I would assess the chest circumference right below the armpit area, the axillary area. Right there. And then I would go ahead and measure the largest part of the abdomen as well. Right there. Okay, got all those measurements done. Next, I'm just going to assess the baby's skin. So centrally it should be pink. It would be a little cyanotic in the extremities and the hands and the feet. I want to make sure that it's consistent with its genetics and its ethnicity. I want to check the texture of the baby's skin. I want to assess the turgor, make sure there isn't any thinness or kind of dryness like you would see in a preterm baby. I'm also going to be looking for lanugo, and which is just the fine hair on their skin. I'm going to be looking for any rashes or the stort bite that's on their head, just to document it. I would also want to look for Mongolian spots, which I think are typically seen right about here. I would also be assessing for vernix, which is just the white coating seen after delivery. Next, we're going to move on to, so with skin, I also want to make sure that there isn't any jaundice, so any yellowing of the skin. I would check the sclera, just the general appearance, making sure there aren't any yellow areas, and if there were, that would be a concern. Now we're going to move on to reflexes. So the first one I'm going to do is called the blink reflex. So I would have a flashlight and just move it into the baby's line of vision, and it should blink. Do it on the other side, it should be blinking. While I was there, I could also assess the pupils equal, round, reactive to light, the pupillary reflex. Next, I'm going to move on to the Moro or startle reflex. So I could do that by snapping, and they should have a startled response. I could also pick them up and support their head and just kind of drop them a little bit. And with this reflex, their reaction should be symmetrical. So both of their arms should go up, their legs should go out. Next is the rooting reflex. So I would just stroke the side of the baby's cheek, and their response should be to follow the finger. I would then place my finger in the baby's mouth, and this is the rooting reflex, or not rooting, sucking reflex. And I would also be feeling the palate for any clefts or abnormalities that would make it hard for the baby to feed. Next, I'm going to do the palmar grasp. So I'm just going to place my fingers inside of the baby's hands, and they should be grasping it. Same with the feet. Just have the toes curl around your finger. Next is the Babinski. So that's just an upside down J on their feet, and their toes should fan out. Next, I'm going to do the tonic neck reflex. So I would just turn the baby's head both ways, and for either direction that I'm putting the head, that hand and leg should go outwards like a fencer. Okay, next is the prone crawl. So I would just place the baby on their stomach right here, and they should just start to crawl a little bit. While I'm here, I would also be observing for symmetry in the hips to make sure there aren't any dislocations. And there aren't, symmetrical. Okay, we want to make sure we check trunk incurvation. So I would just run my finger along the baby's side, and they should kind of curve into the finger. Okay. Let's see, next is the head. So we already assessed the size of the head. We want to observe for any molding at the top where the fontanelles are. Molding is just caused by the delivery, and the fontanelles just kind of shift. We want to check for caput or cephalohematomas, just to document. Next, we would move on to the face. So we want to make sure everything is symmetrical. We want to look at their face for any marks from forceps or vacuum extractors, and just document that. I also want to look for milia, which is just the sebaceous glands, the white bumps on their face, and document that. Next, we want to look at the mouth. So we already did our sucking reflex, and we checked the palate for any abnormalities. We want to check the tongue to make sure it's freely moving and the frenulum hasn't impeded the tongue's movement and made it harder for the baby to eat. Next, we're going to look at the ears. So we want to make sure that the top of the ear lines up with the outer canthus of the eye. If it is a little low sitting, that could be indicative of a genetic abnormality, and you may want to look further into other signs and symptoms. We also want to make sure they have ready recoil, so we would move the external ear inward like this and wait for it to pop back out. In preterm babies, it's usually not there or very slow or sluggish. We want to make sure that the baby's hearing. Usually we can just assess this by watching their reaction to hearing their mother or father's voice. Next, we're going to look at the eyes. So we already checked for our blink response and our pupillary response. We did our pupils equal round reacted to light. We want to look at their eye color, their eyelids, making sure their eyes are moving. We want to look at their sclera for the jaundice, like I said before. We want to make sure the conjunctiva is pink. Normally there is kind of edema in their eyelids, so that's normal. Look at their lashes, their lacrimal glands, make sure everything's normal there. Next we would move on to the nose. So it's going to be kind of smushed in appearance from delivery. We're going to check for patency in their nares. So you can do this by just placing one finger on each nares, usually with the baby's mouth closed, so since they're mouth breathers. Next we're going to do the abdomen. So we already did the circumference. We want to check the umbilicus, and it should be clamped with Wharton's jelly. Okay, we want to check the femoral pulses and the inguinal pulses. So just right here, here, make sure everything's flowing right. Okay, and next is our neck. So they have short little necks, and we just want to make sure that there aren't any extra nuchal folds and that it's freely moving. We'd move on to look at the clavicles, make sure they're intact. If there were a fracture in one, we would notice some bulging or asymmetry in their placement, their arm placement. Next, we'd listen to their heart sounds. We already did that with our apical and 5 heart areas, and it's normal for them to have a murmur in the first 24 hours. Next, we're going to move on to the extremities and the trunk. So we're just looking at the general appearance. We want to make sure that the chest is moving up and down without any labor, no retractions, so that the baby, we know the baby is able to breathe appropriately. We want to look for adequate chest development, like in term babies, and make sure they are healthy there. Their nipples are normally a little bit elevated, and we can measure that. We want to check their hands and their feet, make sure they have the appropriate number of fingers and toes. We can check their spine for the C shape, and we want to make sure there aren't any indentations or hair tufts. We checked the hips earlier to make sure they were symmetrical and there weren't any dislocations, but we can also do the Ortolani maneuver. So I would place my fingers here, hold the baby's legs, and maneuver them outwards and back in. And it just should be symmetrical, no issues, freely moving. Their legs and hands should be flexed. They should have normal flexion. We've already assessed for jaundice. Just make sure there isn't any general yellowing of the body or sclera. Next, we move to the genitalia. Our baby's female, so we would be checking the mons, the clitoris, and the vagina. It's normal to see a little bleeding from the mom's hormones. In term babies, the labia is more prominent than the clitoris, and in preterm babies, the clitoris is more prominent than the labia. So we'd just be assessing for that, making sure everything's normal there. In a male baby, we would be assessing to make sure that the urethra is on the tip of the penis and not under it. We would be palpating the scrotum for testy distension. Yeah. And we want to look for rugae on the scrotum as well. And just assess for all the normal findings. We would also want to be assessing their bowel movements and voiding on the first day. They should void at least once. With the bowel movements, they should have 2 to 3 of meconium, which is just a really yellow liquidy state of bowel movement. And we already assessed the butt, and it's symmetrical, no hip dislocations. And if they have had a bowel movement, we know that the anus is working. Whenever the baby was delivered, we would have known if they were crying appropriately. We would also assess for pain with the baby, and that can be done by listening to the cry, and there are a couple of outlets for that at hospitals, some charts and scales that we can use. Let me see if I forgot anything. Okay, I think that concludes our assessment today. Thank you for watching.